So to fully understand the processes of thrombosis, embolisms and infections, you first sort of have to understand the normal morphology of blood vessels. So there are three main types. You've got your artery, your vein and your capillary. And there are four main differences between the three. So there's differences in elastic tissue, smooth muscle tissues, the ratios of the size of the lumen to the thickness of the wall, and the presence of valves. So in the main things to remember that for the elastic tissue, there's most in the arteries, then it's sort of reduced in the veins, and then there's barely any in the capillaries. The same going for smooth muscles. Arteries have a smaller lumen but a very thick wall, whereas a vein has a thinner cell wall but a very, very large lumen. And a capillary has a very small lumen and a very thin cell wall. And valves are only present in veins. This is to prevent backflow. You need it in the veins because your veins are what's pump the blood back up, so they pump it up the legs, so they're pushing blood against the force of gravity, so the valves prevent backflow. Blood and lymphatic vessels all have the main cellular components of the wall, and these are the endothelial cells, the smooth muscle cells, and then pericytes, which are the cells normally arranged along capillaries and venules. So you can see they have at the very, very outer layer, which is the tunica. I apologise for my pronunciation of these words. Adventia, this one, the like sparkly pink coloured one. That's your very outer layer. Then you have your next layer, which is the external elastic membrane. After that you have smooth muscle, and your tunica media is what's made up of these two layers, so the external membrane and the smooth muscle. You then have an internal elastic membrane, which is this purple bit, and your endothelium wall of the inside of the lumen, and together these make up the tunica intima. The tunica intima. I remember to say that one. And just a quick recap on endothelial cells. So the endothelium is a type of epithelium tissue that lines the interior surface of a blood vessel and lymph vessel. It forms an interface between the circulating blood or lymph and the rest of the vessel wall, and it's made from a thin layer of simple squamous cells known as endothelial cells. They have a variety of roles. Some sort of resting functions of them are maintaining non-thrombotic blood tissue interfaces, so non-adhesive surfaces so that thrombi can't form. They influence blood flow and vascular tone by dictating how smooth the blood flows. They can modulate inflammation and modify lipoproteins in the vessel wall. They affect smooth muscle cells by producing relaxing and contracting factors, so things like scroll down a bit. So things like nitric oxide, which allows for relaxation, and endothelin, which allows for contraction. They also have a role in metabolizing hormones, and they're also semi-permeable membranes, so that substances and sort of like immune cells, so like leukocytes, can move in and out of the blood and the tissues. But for them to be able to do these sort of normal expected functions, you need obviously sort of smooth laminar flow of blood and good blood pressure, so there's not too much pressure on the vessel.